Mr. Graver, talk me through what the women are going through when they come to you for reconstructive surgery.
Well, first of all, for them it's a huge traumatic event in their life. They just heard they've got cancer. They're in shock. We discuss the whole treatment through. We talk about reconstructive options. I examine the patient. Each patient is different. First of all, for me it's very important direct communication with the rest of the team. Professor Apfelstedt as the oncologic surgeon. What type of mastectomy? Is it a partial mastectomy? Is it a full mastectomy? Skin sparing, where you keep the skin, or where you even keep the nipple and the areola complex for cosmetic purposes, if it's safe to keep it. That's very important. It's important for me to communicate with the oncologist, find out exactly what the treatment afterwards will be. Will it be radiation, after the mastectomy, radiation treatment? Will it be chemotherapy, or is the chemotherapy before the treatment? Then I have a very close look at the patient, at her. Body habitus, activities, is she fit, age, size of the breasts, lots of factors that I look at. And I believe there's a specific type of reconstruction that we have for each and every patient. Sometimes it's difficult to find the right option, especially if we have severe treatment, radical mastectomy, radical treatment afterwards, radiotherapy. It's not that easy. There's more complications that we can expect, but there's usually some way we can reconstruct. The big pathways of reconstruction is you can use your own tissue, or you can use implant material. Nowadays we talk a lot about silicone implants, saline-filled implants, anything that is basically foreign body material that we implant, that we put in to replace the volume of the breast. And then of course, if we talk about partial mastectomies, oncoplastic surgery, Prof. Apfelstedt will remove a part of the breast. In the same session I will put everything together, that it looks nice, reduce the size of course, because part of the breast is removed, and then do a reduction on the other side, that it looks the same.
Now, what are some of the common concerns that patients have when they come to you?
Concerns, of course, a lot of patients are worried about the costs, because they worry that it's perceived as cosmetic surgery and that medical aids do not pay and that they have to pay for themselves, which is not true. Medical aids pay for breast reconstruction after breast cancer. They even pay for symmetrizing, if you have to make the other side smaller, second stage operations. So that is also one of the misconceptions. Other concerns is normal concerns, hospital stay, how long do they take to get back into work, into normal life.
How long does it take to get back to work or back
Depends on the type of surgery. We have smaller procedures where it usually takes about 2 to 3 weeks. Then we have larger procedures, more extensive procedures where we use own tissue reconstructions, often with microsurgical techniques, where the surgery takes sometimes a whole day. Hospital stay is a week, and recovery is about 6 weeks after the surgery.
So it sounds like it doesn't have to be this panicked, shocking state if you find the right people to take care of you.
Exactly, and it gives the patient a sense of security, because right from the start she knows all members of the team and that they are working together, and that gives the patient an awful lot of peace of mind that she's getting the best treatment possible.
Now, during Breast Cancer Awareness Month, we talk about doing breast examinations, going to your doctor to do it, or do it yourself at home. How often should women be doing this?
Once a month is perfectly okay. If you're premenopausal, that means if you regularly menstruate, then you should do it in the week after your menstruation. If you're postmenopausal, and that is the age group where we see most of the breast cancers, then you might wish to do it on the day that your salary is being paid, or on the full moon, or on the new moon. It's up to you, but once a month.
All right, now if we want to get a hold of either of you, how can we do that?
Best via the internet, www.apfelstedt.com. Otherwise, Google us, And Prof. Greve is at?
ProfessorGreve.com.
Yes.